Hello, everyone, and welcome to today's 30-minute webinar, Tools and Tips for Quickly Connecting Families to the Expanded Child Tax Credit, or the CTC. I see folks rolling in, and in the interest of time, we're going to just go ahead and get started because this is a fast presentation today. And for any folks who aren't familiar with APHSA, we are the American Public Human Services Association representing state and local public health and human services agencies. I am Jess Manili, Senior Policy Analyst for Technology and Analytics with APHSA. We also have Ann Flagg on the line, Senior Director of Policy and Practice with APHSA. And we are joined today by our two panelists, Isabel Dixon, Economic Mobility Specialist with the Colorado Department of Health and Environment. Her work at CDPHE focuses on maternal and child health and implementing evidence-based strategies to improve economic mobility for Colorado families. We're also joined by Richard Auxier, who is a senior policy analyst at the Urban-Brookings Tax Policy Center, whose work focuses on tax policy, budgets, and other finance issues. So a really good team to be talking about the child tax credit and outreach strategies. Quick overview of today's agenda. I'll set the stage really quickly, and then I'll turn it right on over to Richard to talk about the Tax Policy Center's new data visualization tool that demonstrates where families are likely to miss out on the child tax credit. And then I'll shift to Isabel to discuss how Colorado is helping to find those families and connect them to this historic program. And then we'll take Q&A at the end with any remaining time. I should also say I'll be monitoring the chat. So if you do have questions throughout the presentation, please feel free to put them in the chat and I will keep note of them and we'll facilitate that at the end. So for this stage, the child tax credit, with the amount of information going around about this historic benefit, you may already be aware of the changes to the CTC that the American Rescue Plan made. Some notable ones included increasing the total amount of the child tax credit, so a $1,600 increase in the credit for every child under the age of 6 and a $1,000 increase for kids aged 6 to 17. It also removed minimum income requirements and changed the disbursements from a lump sum in tax season to monthly installments for families from July to December of 2021. Which is really great because it's helping families meet immediate needs that the pandemic has brought on through economic hardship. The problem before us, and it's a little bit of an urgent one, is that there are estimates that millions of eligible families who don't normally file income taxes because their incomes are too low to be required to are potentially missing out on this really important credit. And that these families, non-filers, they're being called, have until November 15th to give the IRS their information so that they can start receiving these advanced payments. So experts on the ground and like across sectors really have been developing tools, resources, and all sorts of aids to facilitate connecting these non-filers to the child tax credit. So I'm going to turn it over to Richard to give us a demo of the Tax Policy Center's new data visualization tool. And then we'll hand it over to Isabel to discuss how Colorado is implementing outreach strategies on the ground and connecting non-filers in her state to the child tax credit. All right, Richard, you get to share your screen.
Awesome. Thanks so much, Jess and Ann and everyone for having me here. My name is Richard. I work with the Tax Policy Center, and I am here because we recently created this data visualization tool. So you should currently be seeing a map of the United States with spots of blue. First, I want to talk a little bit about the data that is fed into this tool. So as Jess did a good job setting us up, the American Rescue Plan expanded the child tax credit. And critically, it expanded it to low-income families who were previously ineligible for the credit. These families are by definition low income, so they might have the most of benefit from the child tax credit. But because they were low income, because they didn't have possibly a reason to file, there was no benefit to them, they're not attached to the tax system. And so these are the types of people that we need to reach out to and find and ensure they're getting the benefits they're entitled to. What we're doing to try and help with these is highlighting Treasury data. The Treasury Department put out data on children who appear on health insurance forms. It's the form 1095 that you get if you have exchange healthcare through an employer, or maybe more likely for this group, healthcare through Medicaid. So we know that they are children because they're on these healthcare forms, but they do not appear on tax forms. And there are about 2 million plus children in this Treasury data. Now, quick note, caveat, highlight. This is not a comprehensive count of the children who are missing out on the CTC. There are probably children in this Treasury data who are getting the CTC because hopefully someone has found them and got them to sign up for it. And then there is unquestionably children who are not getting the CTC who are not in this data. Two very obvious examples: if a child is not on a healthcare form, they're not in this data. And if a child was born in 2021, they are not in this data because it's only showing tax returns from 2019 and 2020. But our thought is, and the hope of the tool is, that these children who we are trying to reach are probably clustered in the same places. And so if we can show you where these Treasury children are via maps, hopefully you can find other children in the same places. So let me zoom in and try and give you a look at what this looks like. So currently, if you look in the top left, you'll see that there are two ways to see this data. There's share of children and number of children. I'm going to start with share of children because this is kind of our assumption of what's probably most important for advocates and outreach. Because what share of children is again, I'm going to call these children Treasury children, but this is children who appear on health insurance forms but not tax returns. Okay, so this is Treasury children in a zip code as a share of Treasury children in the state. So if you look at the state of North Carolina where we zoomed in, the lighter blue means there's a smaller share of these children. The darker blue means there's a heavier concentration. So I'm currently in zip code 27504. There's 118 children on the Treasury list in this zip code, and that's about 0.23%, is 0.23% of North Carolina's total. If you move up closer to Raleigh, we'll go into zip code 27520. In this code, there's 257 children, which is about 0.5% of North Carolina's total. If you go further up into this zip code, 27587, now there's 527 children in this zip code on that Treasury list, which is fully 1% of North Carolina's total. Again, the hope is that policymakers, advocates in North Carolina and in all the other states to take a look at this map and say, if we need to focus our resources somewhere, if we need to concentrate our outreach, where are we going to go? And this would point them to certain zip codes. So one way to think about the share of children is it's actually 51, because the District of Columbia is on there too, individual maps put together. Because we want to show share, we want to show where this is. Dark blue's high, light blue's low, and then unfortunately there is these gray areas. So for example, in zip code 27371, there's no Treasury data. We've talked with the Treasury departments. We think this is because these are relatively low population areas. And so they suppress the data for privacy reasons. But we do know, and if you look to the right side on that legend, you'll see that in North Carolina, there are 3,782 children at risk of missing the CTC. They're not assigned a zip code. So these children are in the data, which you can helpfully download by either the download data for all states button or the download data for North Carolina button, and see them. And then for the zip codes where we do have data, that'll also show that. Also in that download currently is the total number of children for every zip code based on census data. So if you'd like to see the Treasury children as a share of total children in the zip code, you can see that too. Let me zoom back out and again show you the other way to look at this is, of course, again, this is just a share of the state. So your eyes might be drawn to Wyoming, but this is not because Wyoming has a huge cluster of children who are missing out on the CTC. It is because in Wyoming, there's relatively few people and relatively few zip codes. So there are relatively high concentrations of children in each zip code, even though I'm over a place now where there's 167 children. That's why we also provide you this tab, which just gives you the straight count. of the number of Treasury children in every zip code. Now, this is kind of going to look like, a population map. If I go into, like, for example, the Northeast and show you, like, typically the places where you expect to see a lot of children, you are going to see a lot of children. Zoom in, move around, examine with it. But we wanted to do this one just so that people could see that the share of children is one metric and the total of children is another metric. But also because if you kind of scroll down on the tool, we provide the top 50 zip codes of where these children are. And this is for in case there are national efforts to reach these children. And you want to think about, if you would go to any zip code in the country, where would you put that data? In general, we know that, again, this data is not perfect. We know that it is not showing everything. And we know that there are places, for example, we talked to some people in Philadelphia where there was a high concentration of children in a place where there were, like, are no children. And, like, why is that? And the reason was because that was where there were administration buildings for foster centers. And so there are children in there because that's where they're filing, but there aren't actually any children in there. And so this is something that, like, we think it's unfortunate, but we want to learn from it. And so something that we have a email set up, just ctc@urban. For the hope is that people will use this, go out to these places and report back so we can learn more and possibly even work it into the tool. We're thinking of possibly adding economic and demographic to the data you can download and making other improvements that'll help policymakers and advocates use this. Okay, and with that, I'm going to turn it over to Isabel and share a different screen.
Thanks so much, Richard. It's great to see. So now that we've gotten a picture of where families are potentially missing out on the benefit across the country, I think this is a really great opportunity to bring Isabel up to talk about what Colorado is doing about it in their state.
Great, thanks, Jess, and thanks, Richard, for advancing the slides. I'm Isabel Dixon from the Maternal and Child Health Program at the Colorado Department of Public Health and Environment, and I'm really excited to be here today to talk about the expanded child tax credit under the American Rescue Plan Act. Next slide, please. I'm going to tell you a little bit about what it is and why it matters for the families we serve and what we've been doing in Colorado to connect families to the child tax credit. Next slide. So a little bit of background about what it is and how it works. Jessica covered some of this, so I won't spend too much time here, but it's a transformative anti-poverty initiative and has the power to reduce child poverty by 40%. Eligibility has changed in that low-income families are now eligible. They weren't before. It's increased in amount from $2,000 to $3,600 for kids 0 to 17. And it's refundable, and that can be done by check or direct deposit. And most all families are eligible for some level of this credit, 92% of families. Next slide, please. Why are we in human services and public health talking about taxes? So put simply, tax credits reduce poverty and improve health and educational outcomes. And we know that poverty is a root cause of poor and inequitable health. We know that tax credits are associated with fewer adverse childhood events, reduced parental stress and reduced trauma and child maltreatment, and improved long-term outcomes. Disparities in access to the full child tax credit are also reduced under the expansion. Next slide, please. So tax data is usually delayed by a couple of years, but we're very lucky in this case to have some recent data from this summer analyzing the impact of the first round of payments in July, thanks to the Census Bureau's Household Pulse Survey. This new data indicates that the first payment of the child tax credit kept approximately 3 million children from poverty in July, and that food insufficiency and financial anxiety were significantly reduced. And in fact, the number of households that reported not having enough to eat dropped by 3.3 million, or nearly 1/3, in the weeks after the IRS issued the first payment. What did families spend their tax credit payment on? 47% reported spending their payment on food. About 17% of households with one child under 5 reported spending the money on childcare, and 57% reported using the credit for school-related expenses. Next slide, please. How do families claim it right now? If they filed taxes in 2019 or 2020, they don't need to do anything. They are in the system. But for those who are not in the IRS system, as Jess noted, we call those non-filers. They need to use the IRS non-filer portal to sign up and get their payments. So I really want to highlight that our outreach is focused on these non-filers. It's them that we want to reach using tools like what Richard has developed. And families might not know that they're eligible for the benefit or know it exists at all. So it's a powerful policy change, but families need to hear about it so that they can engage with the IRS and get their credit. What do we know about who doesn't file? It's typically low income, below about $24,000 a year household income. Also, new parents might not know that they need to update their info if they've had a baby. There's an update portal where they can do that. And then based on what we know about the earned income tax credit as a proxy, non-filers as a group have a higher proportion of immigrant and refugee populations, non-English speaking populations, and rural families. So a lot of our programming is targeted there. Next slide, please. So now what are we doing in Colorado to promote the child tax credit and reach these non-filers? These are our strategies: outreach and messaging, supporting navigators, referring to free VITA tax help, that is volunteer income tax assistance sites, increasing co-enrollment with other benefits, and then working through new and existing partnerships. And I'm going to go into a little bit more detail on the next few slides about what these strategies look like in practice. We can use the tool that Richard was describing to be strategic with our resources with all of these strategies and to help focus our efforts. Next slide, please. So this past spring, we created a messaging toolkit and began using our public health programs and partners to get the word out because we had easy access to those programs. This is an example of our messaging, and our message right now is that it is not too late. Families still have until November 15th to get in the system. We're also in the process of developing a full communications campaign focused on reaching non-filers at the community level, including working with community influencers. Next slide, please. So we're also focused on co-enrollment, and what this means is bundling tax outreach with existing referral efforts for other benefits such as SNAP, WIC, and childcare subsidies. And here's a few of the settings we're using to do that in. So that just means when folks are talking about WIC and SNAP and how to access those benefits, that they also talk about the child tax credit. 3 of our local public health agency grantees are integrating child tax credit outreach into their existing enrollment activities starting this month, including pop-up enrollment events and mobile enrollment vans. We're also partnered with United Way and their 211 call center and strengthening their call center with training and materials. Next slide, please. Just briefly, VITA sites, volunteer income tax assistance sites are places where IRS trained volunteer tax preparers can help filers complete their tax returns. So we want to make sure that navigators don't have to be tax experts and have a place to refer people if they have more complex questions. And so as part of our effort, we're engaging with these VITA sites to support them to expand, to get the word out about where they are and how to make an appointment, help them prepare for the 2022 tax season. And we're also releasing a mini grant application process to engage with them and support them. Next slide, please. Another strategy we're focused on is strengthening, that should say navigation and referral, strengthening referral to tax filing. So that means supporting navigators to talk about taxes. And what I mean by navigators is anyone who works with families to refer them to services or is a trusted voice in the community. So the idea is to raise awareness about the power of the child tax credit with busy navigators and care coordinators and assisters, and then support them with really simple information that works for any level of engagement that they have time for with their clients. And we also want to learn from navigators about what their comfort level is in talking about taxes and what they think barriers to tax filing are for their families. We're also exploring placing navigators in pilot direct service sites for warm handoffs directly to tax filing services in the new tax season coming up in 2022. Next slide, please. So this also says navigation and referral. How exactly should we connect families? What should we say? What should we ask? There's really no need to get into complicated eligibility questions. It's really just, do you have children? Have you heard about the child tax credit? Are you getting these payments? Do you file taxes? And then providing resources for next steps and moving on. It's certainly possible to learn all about the ins and outs of the tax code if you have the interest or the time. There's a lot of frequently asked questions and navigator resources out there that we have on our resources slide at the end, or to have a list of frequently asked questions handy, but it's not a necessity. You don't have to be a tax expert to talk about the child tax credit. Everyone's situation is different. And if it's complicated, if there are custody issues or things like that, really just refer to a source for trusted tax information or a tax professional. Next slide, please. So we want to get the word out about the child tax credit, but also address some of the common concerns that are barriers for people to file their taxes. There's a few key features of the child tax credit we want to make sure that navigators know and families know. So unlike the earned income tax credit, you don't have to have earnings to claim the child tax credit. It does not affect other benefits such as SNAP and WIC. There's no benefits cliff associated with the child tax credit. And families with mixed documentation status can still claim the child tax credit as long as the child has a social security number. Parents and caregivers can claim the child tax credit using a tax ID number or ITIN number, just as long as the child has a social security number. Another barrier is the concern that claiming the child tax credit might affect immigration status, but it does not. The IRS does not share citizenship information with immigration or any other federal agency. Next slide, please. So our outreach depends on our partnerships. We started with internal state department, health department programs just because we had easy access to them. We're expanding our efforts through a partnership with Department of Human Services in Colorado and other state agencies. The Department of Revenue has been great with data. And then some examples of our outreach this year, we did a text campaign with Bright by Text, 3 of them now, 2 of them, but 1 on the way, out to 15,000 caregivers in English and Spanish. We partnered with our LEAP Energy Assistance Program for a flyer that went to thousands of Colorado households. And we're presenting to lots of multi-partner work groups like our Family Leadership Network and Blueprint to End Hunger. Next slide, please. These are some other examples of good settings and connections and partners to get the word out. We have a physician champion who's presented to the Colorado AAP. We have a safety institution, Denver Health, that's looking at handing out with post-appointment printouts information about the child tax credit. Food pantries can be a great way to reach non-filers. One example I love is our partner at Tri-County Health Department in Denver, in the Denver area, stapled 400 flyers to food boxes about the child tax credit with a QR code on it, and these went into the households. We're partnered with some national organizations that provide tax expertise to us so that we make sure that our messaging is correct. And we're also partnered with AmeriCorps for increasing our people power to get the word out. Next slide, please. So we're watching the federal legislation, of course, hoping that it becomes permanent, and ramping up our communications plans and our opportunities for more trainings with more navigators, translating into more languages with additional resources, and evaluating and improving and continuing to scale up. Next slide, please. And these are a few resources to toolkits and more information and some guidance for navigators. And so that's all I have. Thanks so much.
Thanks so much, Isabel. I won't bring it. My final slide just says Q&A on it. So I think we could just stay with our faces up here for the Q&A. I find your approach to outreach and just partnering across all these different agencies really aspirational. And that's why we're trying to highlight this for our attendees today and the people who registered but weren't able to make it. We will send the recording out and the resources that were shared. There's only one question in the chat right now, which I believe is for you, Isabel, around the grant program to VITA sites and how large that was.
Yeah, sure. Just due to our contracting processes, the limit is $5,000 per VITA site. And we're really encouraging or prioritizing proposals that are related to increasing ITIN numbers and allowing these VITA sites, or encouraging them to take a training. I think it's a 7-hour training that allows them to enroll ITIN or receive applications for ITINs or individual tax ID numbers.
Awesome. Got one more question. How old would a child be right now for the parent to be eligible?
So children are eligible from 0 to 17. So if a baby was born in 2021, they are eligible. If your baby turned 18 in this year, they're not eligible. I hope that answers.
I hope so, but if the person who asked the question, if that didn't answer your question, feel free to throw that in the chat, and we can also offer to follow up offline.
And those resources links are just great for questions like this.
Yeah. Someone commented that the biggest bottleneck in Oregon is the lack of tax navigators, which I feel like is probably not unique to Oregon. Do either of our speakers have anything to add on that, or maybe how to use non-tax navigators?
Yes, it is a really big challenge, and we think of it as tiered navigation training. So just a basic overview for some groups is plenty, and then like a flyer with a QR code can be on the wall behind the person. You know, most navigators and care coordinators and home visitors do not have a lot of time to either learn about taxes or talk about it in their engagement. So just providing that basic level of why it matters, and here's some more information. The VITA site volunteer piece is tougher, but we are engaged in some volunteer recruitment in a partnership with AmeriCorps. And I know that AmeriCorps at a federal level is very supportive of these efforts, and it might be worth partnering with them to see if that could help increase the number of navigators. They have an amazing network of people power through all their different programs like Senior Corps, foster grandparents. They have a lot of great ideas and resources.
So I'll just add that in my spare time for fun, I'm a VITA volunteer. And if you want to be a VITA, if you want to be a VITA volunteer, I actually encourage everyone to be a VITA volunteer because you don't need to know that much about taxes to do it. However, you do need to take courses to get qualified to then do it. But for signing people up for the CTC, that is different. In fact, they said that you don't have to. Anyone can do this. You can assist anyone. And in fact, I've now been on a couple of these calls, and a few people that have done outreach have said, like, the word tax, surprisingly, just isn't good. Words like benefit are good. And finding anyone who can get out to these places and talk about the child benefit that they're eligible for is just great to get them signed up and ensure they're getting it. And I'm going to kind of use the segue into one of the other questions about the November 15 deadline to just add, you know, we're trying to ensure that everyone's signed up, that we're reaching people, and that for the moment they're getting the monthly checks. But all of this is for tax year 2021, which means it's benefits that you can also get when you file in the spring of 2022. So if someone missed out on everything the entire year, but then filed a return, they could still get their eligible benefit when they file. In fact, everyone's going to have to file and reconcile all of that wonderful tax math to ensure they're getting the benefits that they're eligible for.
Thank you, Richard. Yeah, I saw the question. Yeah, if they miss the November 15th, it's okay. They just need to wait until late January to file their taxes, and they'll get the whole lump sum. And then for adding a baby, there is a update portal that the IRS has that you can find through these links and resources where you can change your income or add dependents.
I love this latest question that we just got, even though we only have about a minute left. So I'll pose that and then I'll do a quick wrap up in less than a minute. We got a question about what resources have been the most helpful to you to stand up these outreach efforts on the ground, and who in the state brought everyone to the table to make this happen?
It's a great question. I mean, we just started small with our own messaging toolkit because there wasn't one yet, and using our own, we're maternal and child health. So we just connected to programs that we had access to, like our program for children and youth with special healthcare needs, child and adult care food program, things like that. What happened is that the governor's office in Colorado took an interest in this and is bringing other state agencies to the table, which is really different at that level than us calling up agents, other programs at Human Services and saying, hey, this is cool, would you like to partner? It's at a different level now, and we're very grateful for that support, that he's elevating it, that his office is elevating it to that level and engaging all the state agencies. But I don't think you have to have that scenario to really make a huge impact across programs, just through presenting in newsletters and making the case to other agencies about why everybody should be engaged in this.
And I'll just add, based on some other conversations, again, like Isabel's evidence is going through established networks, because, you know, our best guess is to use other programs that assist low-income people. So your Medicaid, TANF, SNAP, you know, just if you have networks, you got to go quick, and that these are probably going to be the best ways to do it.
All right, thanks everyone. We are at less than a minute left. There are a ton of questions that we weren't able to get to. I'm going to save the chat. I'm going to save the Q&A. I'm also going to quickly just add my email to the chat in case you have any additional questions that didn't get thrown in the chat. Send them my way. APHSA is convening additional webinars, really short ones. We want to respect everyone's time, but we also want to highlight all the great work happening and make it feel tangible for your state, your county, your local jurisdiction to really jump in on. So I'll share the recording out, I'll share the decks and the links and all of the great resources that were presented today from Isabel and Richard. And we will be in touch. We are not going to let up on this until that deadline is passed and as many families have gotten connected to the benefit as possible. So thanks, Isabel. Thanks, Richard. Thanks, everyone who joined.
Thanks so much.
Thanks.
Have a great weekend, everyone.
Bye.